Welcome to the second and last day of the virtual conference, everyone. I'm so glad to see you here again, and thank you once more for giving up your time to be here. So, as Azali mentioned, we're going to start the day with a session on immediate support and care. The first part of this session will emphasize survivors' voices. We'll have the privilege to first hear from a survivor advocate who will reflect on their experiences of the support system. We will then turn to Lisa Slavovsky from the International Justice Mission, who will share their perspective on what survivors need and want from the support and care system. We will then invite Lord McColl and Dr. Carol Murphy to discuss existing gaps within the care system and talk about how individuals can leverage their positions to plug these. Finally, we'll be joined by Lisa, Carol, and Lord McColl for a short Q&A session. You're welcome to post your questions in the chat box throughout the session. I will then select 2 to 3 questions which speakers will be happy to respond to. Thank you very much, and I hope you've enjoyed the content.
Okay, thank you, Favor. Just a few more questions. In your earlier session, you told us that you returned back to Nigeria October 31st, 2017.
Yes.
Can you tell us how that happened?
Okay. When we were in prison, before Nigeria embassy came, they said we should not worry that our people also came and put down our name. So before we know, they come and put down our name. So after 2 weeks, they deport us back to Nigeria. So when we come back to Nigeria, then they profile us. Then when we are leaving, they give us 40,000 in embassy. So they rent hotel for us and feed us on one day. Then all of us come back to Benin.
Okay, you mean 40,000 naira?
Yes.
Okay.
So then after 3-4 months, they called us for training. So we went to the training. They asked us to bring some things. So it was because they group three people. They will group 3 people and open shop for them. So some of us now, they don't have that mind to say, let me do business with somebody I don't know. So even when you send your documents, sometimes it will take a year before they answer. So many of us just lose hope from there.
Okay. So what about the Nigerian government, including the Edo State Task Force Against Human Trafficking? Did you receive any support from them?
No.
Okay. What services did you feel you needed once you returned to Nigeria?
Once I returned to Nigeria, what we really need was anyone that learn a skill that will have be a shop for them to be working, so that they will get their memory back. Because most of us who lost our mind, many of us were frustrated on that journey. So, and number 2, when we were coming, we were supposed to go to hospital straight. I can say many of us they are not still okay till now, since 2017, because they need medical attention. Because we pass through a lot in that country. We drink salt water for months. So I think they will have put more effort to help us very well, because we need the help. I know of many returning now. They are still doing prostitution here in Benin because there is no help. Because there is no good support. Yes.
Now, you've been in Nigeria for, I think, about 3 years now. You returned October 31st, 2017, like you said earlier.
Yes.
What services have you received so far?
I received services from Pathfinder. They opened shop for me. They took me in like their daughter. They are there for me in any angle.
Okay. Now, in what ways can survivors be better assisted by their home countries when they return?
Like I said before, there will have be a place for them to be working, and anyone that did not learn skills, they will just train them and open a shop for them, so that their mind will to calm down, because most of us, when we come back, our eye is still we still have that thought of traveling because there is no help. So I think if there is earlier help, most of us will be okay.
Okay. Thank you, Favor. Thank you so much.
All right, ma'am.
Good afternoon, everyone, and welcome to the first part of today's session on immediate support and care. My name is Emily Dunn. I'm a project officer at the Commonwealth Parliamentary Association UK, and I'll be chairing today's discussion, where I'm really pleased to be joined by Lisa Slavovsky. Lisa is a senior aftercare specialist for the Africa and Europe region at the International Justice Mission, a global organization which, among other things, partners with survivors on the front lines to ensure their immediate and long-term needs are met. Lisa is with us today to discuss what survivor-informed holistic service provision looks like and to share her experiences of incorporating the voices and perspectives of survivor into care provision. Lisa, thank you so much for being here. Can I start by asking you what, based on your current work with and feedback from survivors, you would say are the most significant gaps in current survivor care and support structures?
Yes, thanks so much, Emily. I'll start just by saying I've been working in this sector for a bit over 12 years. And so when I think about and talk about the current gaps that we're seeing globally for survivors of modern slavery, there's such a difference between what we're seeing now versus 10, 12 years ago. And there's just been such a progression in service availability for survivors, which is so encouraging. But as I think about some of the gap areas that we've really heard consistently from survivors that we work with globally, and even in our own assessments of local structures that support survivors, first would be trauma-informed responses across justice systems and social service actors. Many of the survivors that we engage will say that their engagement with first responders, whether police or others, as well as within legal systems, is often lacking an understanding of trauma. So this can take the form of being detained or feeling untrusted or not having an adequate explanation of what's happening. Yet we hear from survivors that these types of responses are so critical when done well to feeling safe and being willing to engage and access services, whether social services or legal proceedings. So this is an area we really focus on globally, seeking to build up trauma-informed responses across both justice systems and survivor services. Second, often a coordinated continuum of care that works with survivors from the point of their identification through safe recovery is lacking. In many contexts, this may mean that survivors only feel that they have access to services if they're in an urban setting or in shelter-based services, but that services in their home communities are either lacking or there's not coordination between service providers to ensure that they don't fall through a gap. In some places, we've seen tremendous innovations that build up those linkages, whether coalitions of service providers or strong linkages between government and NGO providers, particularly when services need to be maintained and coordinated across jurisdictions or cross-border settings. And then lastly, we see that services for men and boys are often lacking. We've seen this across many global locations, and while robust and holistic services are increasingly available for women and girls, there are often many gaps for men and boys, especially in mental health services and safe housing options.
Okay, thank you so much. So you touched in your answer there briefly on holistic care, and I'd like to talk about that in a bit more detail. So can you explain what is meant by survivor-informed holistic service provision and elaborate on how this type of care aids survivor recovery in both the long and the short term?
Sure, absolutely. The goal, at least within IJM service provision, as we seek to really serve survivors holistically, is empowering survivors towards safe integration in their communities in a way that ensures they're at low risk for re-victimization. The vulnerabilities toward risk are so nuanced and so individualized But through inputs from survivors and through research that we've conducted, we really found 6 key areas that have emerged toward long-term safety and well-being. So first is safety and addressing safety needs. So just safety from suspects, safety from others who may intend to cause harm, or even understanding safety within the community or safe migration. Second is legal protection, ensuring that survivors have access to legal supports, legal documentation that they need, and legal representation. Third is mental well-being. That ability to both access services toward trauma recovery, as well as building strong coping skills. Fourth is economic empowerment and education, reducing the economic risks that so often are a part of the vulnerability into trafficking. Fifth is social supports, having strong network of family and community supports. And lastly, physical well-being, access to basic needs and medical care. So within our own programming, and as we work alongside many government and social service providers, civil society providers as well, that short-term and long-term can take take different forms. So in the short term, or crisis care, which is often in that first 30 to 60 days that a survivor, after they've been identified or have experienced harm, really some of those critical needs that often emerge are safety needs, including safe housing, emotional stabilization, and crisis medical needs. But then in really moving toward that longer term goal of safe integration that is a longer term or sustainable reduction of risk, is addressing economic vulnerabilities, trauma recovery, and assessing safety in the home environment to which a survivor is returning. So those are some of the ways that we seek not only to conduct our own service provision, but also really in coming alongside stronger networks of care in the context where we work.
Okay, great. If I may, I'd like to go on to talk specifically about the work of the International Justice Mission. I know that you were involved in helping to develop the organization's assessment of survivor outcomes tool, which it uses in part to develop a tailored service provision plan for each survivor. Can you explain why it's so essential for every survivor to have a tailored service provision plan, and expand upon some of the factors that the International Justice Mission considers when it's measuring kind of survivors' progress towards restoration and rehabilitation?
Yeah, absolutely. So the assessment of survivor outcomes tool is assessing survivors' strengths and vulnerabilities across those 6 areas that I was just discussing. And the hope in utilizing the tool is for service providers to really be able to hear directly from survivors about the strengths and the vulnerabilities that they are facing, and to partner with survivors on a plan of care that's really outcome-based and aimed toward that safe integration in the community. Several years ago, when I was working with survivors more directly, now I'm more in a support role over our programs. And before we had the assessment of survivor outcomes tool, one of the things that I noticed in our programming is we had a lot of service offerings, but they weren't coordinated toward that outcome-based case management. And so an example of what that might look like is I was working with a survivor who had a really close relationship with her care manager, but she hesitated to close the case or really come to that closure of the care relationship because she kept seeing areas of her life where they weren't where she wanted them to be. But in walking with her to identify her strengths and the way that she had overcome key vulnerabilities, she was able to see that she really had the tools that she needed in moving forward and could meaningfully close out that service relationship. So we realized that with the risk that without having clear outcomes and partnering with survivors toward them, we could unintentionally build like a dependency relationship. And so the assessment of survivor outcomes really is in honing that approach of how are we partnering with survivors toward that long-term and sustainable safety and well-being.
Thank you. So you've kind of touched on this in your last answer, but we know that one of the ways to ensure care systems are effective as possible is to integrate survivor voices. And how do you think that other service providers, whether that be governments, NGOs, or other actors who are involved in the survivor care process, can ensure that support services are survivor informed? And if you have any other examples, can you provide them on how you've integrated the voice of survivors into your own work?
Yeah, absolutely. Survivors truly are the best positioned as those who best understand both the problem of modern slavery and the solution. So we view survivor voice and survivor leadership as critical, both within our own programming, but also in having a platform to speak out and advocate for change within their own communities. So IJM has convened a global survivor network, an international group of survivors that's mobilized to advocate for change in their communities and in global context. So this group of survivors have been really instrumental in speaking into IJM's global program standards, our case management processes, and even the ASO tool that we were just speaking about, as well as in building out the resources for equipping justice system actors or social service providers to conduct their work in a trauma-informed way. So we encourage governments and NGOs, how are you gaining survivor input on your program plans, on your training curricula, on advocacy goals or legislative initiatives? We're still building out our own strong mechanisms to engage survivor input in each of these ways, but we've seen that survivor leadership in these areas has truly just propelled us toward greater effectiveness.
Oh, that's great. And kind of finally, I want to talk about the specific needs of one group. So we know that children have really specific requirements when it comes to survivor care. Would you mind expanding on what some of those needs are and how you think service providers can better incorporate and meet them?
Sure. One of the ways that children's needs are unique from adults is just the manner by which children are dependent on their caregivers for safety and protection from further harm. So it's critical for government and civil society providers to have a really strong child protection framework as they design models of care, while also really inviting and prioritizing child participation, both in individualized care plans with children, but also in their broader programming. If a child at the point of receiving care is not in their home setting, or there's an assessment that their caregivers present a risk to their ongoing safety, it's critical to identify as early as possible the long-term plan for a child, and to engage that longer-term care provider, whether that's going to be a parent or an aunt or foster care, in the plan of support for their long-term care.
Thank you so much. I just want to conclude by taking a moment to thank you for giving up your time to be here today and for providing those really valuable insights into what effective survivor-informed holistic care looks like. You've certainly all given us a lot to think about, so thank you. Good afternoon, everyone, and welcome to the second part of today's session on immediate support and care. My name is Emily Dunn. I'm a project officer at the Commonwealth Parliamentary Association UK, and I'll be chairing today's discussion, where I'm delighted to be joined by two speakers who are going to share their experiences about how individuals can leverage their positions to assist survivors in this area. First, we'll be hearing from Lord McColl. Lord McColl has been a Conservative peer in the UK House of Lords since 1989, and for more than a decade has been raising issues of modern slavery and human trafficking in the House of Lords, pushing for greater protections and support for victims. In doing so, he has brought forward 3 private members' bills, the most recent of which is the Modern Slavery Victim Support Bill. We'll then be hearing from Dr. Carol Murphy. Dr. Murphy is a senior lecturer in criminology and sociology at St Mary's University in London and is currently the research lead for the Centre for the Study of Modern Slavery at the university. Her current research examines the barriers to services for people with complex and intersecting needs. Lord McColl, if I could turn to you first. Yes. You've advocated for the UK government to extend victim support measures, most notably in your private members' bill, the Modern Slavery Victim Support Bill, which was reintroduced into the House of Lords in January 2020. Private members' bills often go unnoticed by the press and public and only stand a slim chance of becoming law. Knowing this, why did you decide to introduce a private members' bill, and how have you raised its profile?
Well, going back in the history, I managed to get a private member's bill through both houses in record time, 5 weeks. This was a few years ago, and it wasn't very controversial. It was just changing a medical qualification. But the civil servant said it would take 3 years to do this, and I must withdraw my bill that was proposing to change it. So I said, why? This was the Secretary of State for Health in those days who asked me to withdraw it. And I said, why? Oh, but the civil servant said you should. I said, you tell the civil servants to go jump in the river. I'm not going to withdraw it. And we got it through in about 5 weeks, thanks to a very helpful member of the House of Commons. So I realized you can do it, although, as you rightly say, the chances aren't very good. On the other hand, I introduced the first anti-slavery, anti-trafficking bill some years ago, and I got it through the House of Lords all right, as a private member's bill, but it was a bit stuck in the Commons, so I sent it to the Prime Minister, and he sent it to his Home Secretary, Theresa May, and she took the thing and polished it up, and we sat on a committee to get it right, and it's law. So you can, if you go on fighting long enough, you can get things done. And it's quite a useful way of doing things. So that's why I introduced it, because I was determined that we must get protection for these folks. And the protection really is basically, they were only given 30 days to remain in the country when they were identified as having been trafficked. And 30 days was simply not long enough. Well, we agitated and they increased it to 45 days, which again was inadequate. And so I'm pressing for 12 months, in fact. And we were very fortunate because somebody took the government to law, and the judge said that 45 days was inadequate. It must be longer. And so now it is longer when it's agreed for individual cases. So you just have to go on and on, hammering away. And I think the Bible says it's importunity, which means just making a nuisance of yourself until they do something.
Thank you so much for that. I'm wondering if could you talk a bit more about the Free for Good campaign? I believe that this has been a campaign associated with your latest private members bills in association with a few NGOs. So I was wondering if you could talk a bit more about that and how that came about and how you worked with the NGOs to create that.
Well, we realized right at the beginning that the great thing was to listen to people and to listen to the victims and listen to the charities, because they've been working at this subject for so long and know a lot about it. And so our dream was to get the charities together to work more as a team rather than as individual entities. I can quite understand, when somebody sets up a charity, it's their charity and they want the thing to success and so on. I quite understand that. But when you're looking at the objective, which is to help traffic patients, traffic people, you need all the resources you can get, and you need to bring them together to work in a coordinated way. And that's what it's about. And it's doing very well. And there are a lot of people all over the country doing wonderful things. There's the former Bishop of Derby, Alistair Redfern, for instance. You probably know about his work up north. Wonderful guy who's really helping the subject a great deal.
Thank you so much for that thoughtful response. Dr. Murphy, if I could turn to you next. You've undertaken extensive research into the challenges faced by survivors, including the barriers they face in accessing comprehensive long-term support and care. What are the most common and problematic gaps you've found, and how have you maximized the impact and influence of your research and work on these issues?
Thanks for that question and for inviting me to be here. I think I can only really mirror what Lord McCall has spoken about, and that is that the length of time in which the support is offered to people when they are discovered or identified as victims of modern slavery and human trafficking is just not long long enough. And what happens, and one of the issues that was repeated to me again and again when I did my research a couple of years ago, is that it ends up with this cliff edge scenario where there are no resources for people after that 45 days. Now, I know that since then there has been opportunities to extend the time, but again, the support is still not adequate, because I think one of the things that people reported to me is that clearly the recovery period is not a one-size-fits-all. It needs to be responsive to the needs of the survivor and recognised on a continuum of care and on a continuum of need. So that was one of the main things. There was another really kind of important finding from my study that was about the gaps in knowledge of first responders. So, for example, some first responders don't even know that they have a role to play in this, that they are first responders, and what that means in terms of making referrals, for example, to the NRM and offering support. So perhaps it is a case of policy being implemented without due consideration to its implications and no kind of real resources attached to it. Another finding was about the lack of training for support workers. Some of the respondents in the study, especially, for example, the police, reported their concerns with referring survivors to services because there was no way of evaluating the standards of care. Although the Human Trafficking Foundation's Trafficking Survivor Care Standards is a fantastic resource for this sector, there's no kind of method of monitoring and evaluation of whether people are using that. So kind of anyone can set up an organisation and a charity, and often, very often with the best intentions, but it also seemed that there was a call from the sector when I was doing the research that there is a kind of way of monitoring that the care standards are being used. And just to return briefly to what Lord McCall spoke about earlier on about discretionary leave to remain, the interviews for survivors to remain in this country were often experienced as extremely traumatizing. The interviewers were unskilled and they were very much focused on the process rather than focused on the fact that they were sitting with a potential victim of human trafficking. I know that there have been changes to this process, but I do think that the hostile environment for people from other countries impacts negatively for survivors in the UK. And one of the other things just to say is that I wrote a briefing paper for Lord McCall to support his private members bill, and he very kindly hosted the launch of the report in the Houses of Parliament. And since then, I've worked on implementing, as far as possible, some of the recommendations from my research.
That's wonderful to hear. Could you talk a bit more about how you kind of first came in contact with Lord McCall then, and how that partnership kind of came about?
I think it was probably a bit of serendipity. I think because people in the sector got to know that I was doing this research, and Lord McCall's, I believe, Louise Gleach, his research advisor, who's since moved on, I believe, Louise got in touch with me and asked me about my research and asked me what I was doing and if I could write this briefing paper, which I was absolutely really happy to do, because I also agree with Lord McCall that it is a kind of responsibility of us all to work together to try to improve the circumstances for people, whether you're an academic or a parliamentarian or an NGO or whoever you are. The onus is on us to work together to try to improve the outcomes for survivors.
Thank you very much for those insights, Dr. Murphy. I think that's about it, all the time we have today, but I just wanted to take a moment to thank both of you for giving up your time to be here today and for sharing details about how you've maximised the impact of your work with us. We really appreciate it.
Incidentally, could I just say something?
Of course.
We were greatly helped by a large number of people. It was Frank Field, who was the Labour MP for Liverpool. Wonderful help he's been and continues to be. And Ian Duncan Smith, and they've really been fighting tooth and nail to get things done. So it's, oh, and the other thing I must mention are the Kennedys in the House of Lords, There's Roy Kennedy and his wife. They work with Co-op, and they've done an enormous amount in providing safe havens for these folks. And when I was trying to get my bill through, he came up to me and said, now look, you must prevent people from putting amendments down because that's what delays the bill. And you just tell me if you hear of anyone putting amendments down, because I shall go and lean on them until they stop breathing. So that was a great help.
That's one anecdote for sure. Thank you so much for sharing that. Yeah, thank you again, you two, for giving up the time to be here. We really, really appreciate it. Okay, I think that kind of just about wraps up the time we have allocated for this. But again, thank you so much for being here. We really, really appreciate it. All right, hello again, everyone. I'm now delighted to be joined by the session speakers, Lisa Slavoski and Dr. Carol Murphy, who will be delighted to respond to your questions for the next 10 minutes or so. Lord McCall is unfortunately experiencing some technical difficulties and is unable to join us at the moment, but hopefully he'll be able to pop in at some point. So we've received lots of questions in the chat and there's been some great discussion going on. And unfortunately, we won't be able to get to all of them, but we will try to get to as many as possible. So if I could turn to you first, Lisa, we received a couple of questions on a similar theme about survivor involvement with the IGM's work. So I'm going to group together a couple of questions and hope that you'll be able to answer them together, if that's all right. So
Absolutely.
Okay, great. So we have a question from Ming Dao who asks, in what format did you collect feedback from survivors in your program? Have you had any survivors involved in program design? And a similar question from Glory Williams, who asks, have any of the survivors you've worked with been involved in decision-making that has brought about change? So if I could just ask you to respond to both these questions.
Absolutely. Thanks so much for these questions. Right now, we have offices, we have about 20 programs around the world. So at this point, each office and each program really approaches survivor input in a different manner. In some locations, survivors are heavily involved in the gap analysis that leads to the program development, provides input into program design, into program curricula or training curricula. Often this is through focus group discussions or through interview processes. But at this stage, that looks different, as I mentioned, from office to office. We're in the process of actually working with a survivor leader who's helping to create a standardized approach to how we equip our offices globally to be able to actually speak into our programs. We're in the process of launching a network of survivors, our global survivor network, which is also led by a council of survivor leaders. And so they are really taking a key lead in this process of looking at how survivors are speaking into programming across all of our global programs.
All right, thank you so much. If I could turn to you next, Dr. Murphy. So we have a question from Michael who asks, should Commonwealth states ensure that all survivors of modern slavery receive secure immigration status once identified, at least for 3 years? How does a secure immigration status impact on the risk of being re-trafficked?
Thank you. Can you just repeat the second part of that question, please, Emily?
Sure. So how does having a secure immigration status impact the risk of being re-trafficked?
Okay, I mean, obviously from the research I did, and not just me, there are many, many other people who know about this issue, including most frontline practitioners in the UK, that people not having secure status exposes them to vulnerabilities. They don't have access to recourse to public funds once they come out of the NRM, and many people are vulnerable to being re-trafficked. So clearly, and this is one of the reasons why I support Lord McCall's bill so strongly, and in fact, I believe that he had to kind of draw back a little bit in asking for this to be for 1 year, because I think there is a kind of consensus across the sector in the UK that 3 years would be more valuable and more beneficial. So it's interesting that the person asking the question has mentioned 3 years, because I do think that without that secure status, people are as I said earlier, just made vulnerable to being re-trafficked and to being exploited in all sorts of different ways, because they don't have the kind of support network to fall back on or to draw upon when they're in a country that is not their own country.
Okay, great. And if I could just ask you, we have a question from Alana Wheeler who says, what happens during the reflection period? Would you be able to speak to that?
Oh, that's an interesting question. What happens? Okay. I mean, you know, I'm not a practitioner, I'm an academic. I have done a lot of research and I've done a lot of evaluations of services, so I can kind of do the best I can in terms of what I've learned from my research about the services that are offered. So I have a very strong connection with a safe house in London just for women who've been trafficked for sexual exploitation and domestic servitude. And I mean, obviously, I think everyone here would know that the experiences of people who've been through this have been severely traumatized. So in the first instance, the kind of intention or goal is to help people to just gain a sense of safety and trust, because, you know, it's very difficult for people in that situation to trust law enforcement, etc., etc. So to gain some kind of safety and stability, I guess, is the first thing. And then after that, I mean, again, it differs by programs, but the program that I work most closely with has got so many resources to offer people depending on their different needs. So one of the things I said in the talk was that it's not about one size fits all scenario, because that just doesn't work. And I know a lot of organizations are stretched in terms of resources, but I think the ones I've worked with really acknowledge that the kind of broad needs of people. And that might be, for example, for people who are, you know, outside of the MRM or from other countries, it might be learning to speak English, which is crucial if they want to stay here in terms of reintegration. But there are also other kind of more holistic therapies offered, as well as trauma-informed counselling and therapy. And so some of the holistic things might be things like reflexology, yoga, drama therapy, art therapy, as well as help supporting people through the process from the initial stages into getting back out into the community and engaging with education and voluntary work as well. And ultimately, the goal is for people to gain employment for integration.
Thank you so much. Lisa, if I could just turn to you next. So we've got a question from Estelle Blake, who asks about whether how these issues are reflected internationally. You work across regions in your role. So I was wondering if you could maybe talk less UK focus and talk some about the major problems in accessing supporting care across some of the other regions that are represented by individuals here today.
Absolutely. I currently work most closely with our teams in the Africa region, although previously have worked with our teams in South Asia and Southeast Asia. And so some of the common themes that we see are just needing stronger collaboration between service providers. As Dr. Murphy just mentioned, oftentimes one of the biggest barriers to accessing services is just actually having a level of knowing where to go, having just a streamlined service provision in which those connections are even possible, rather than having all of the onus on a survivor themselves to access a myriad of different services, which can be very overwhelming and confusing. And so that's something that we see in other service settings as well. In some contexts, there just are very limited mental health service providers. For a lot of reasons, that's just a limitation in many locations, and we see that across a lot of the global locations that we work. And so, as I mentioned in my talk, we're really working to boost trauma-informed service provision, so both within justice system providers, whether that's law enforcement or courts, really having that equipping of a trauma-informed approach, but even then in trauma recovery services, that that access to critical mental health services. Another big area is just the need for short-term safe housing access, and that a gap that I had previously mentioned was especially for men and boys. That can often be a major gap in many places globally.
Thank you for that, Lisa. I think we'll have time for just one more question. So we've got one from Phaedra Hartley, who asks, what opportunities are there for improvement within the UK's national referral mechanism? I'm not sure, Carol, maybe you'd like to come on this first?
Yeah, happy to. I mean, I've been having conversations very recently, actually, with a number of people in the sector, NGOs and other organisations about the kind of restructuring of the NRM and the fact that it isn't really fit for purpose and that it misses lots of areas that it really should. There should be better data collection about people. And also, you know, there's been a big problem that I've discovered with my research in terms of when victims, survivors are first identified and it's explained to them about what the NRM can or cannot offer them, oftentimes they say, actually, no thanks. This, you know, especially if they have a regular status in the country, they don't get a sense of safety and security. So there really does need to be an overhaul. And I know that it's under review at the moment. And one of the people that I spoke to yesterday, who's an expert in this field, was talking about the fact that actually it might be that it needs to be completely reinvented as opposed to just being tweaked, because there are so many problems with it. I mean, if you look at the NRM statistics online, they're giving you very, very, very little information about people, about the kind of nuances of people who are referred into that system. And so it's not fit for purpose.
Yeah, exactly. Lisa, would you like to add anything?
Yes, I completely agree that there's a need for that ability to both create individualized responses and have individuals access according to their individual needs. And so having just a strength of even partnering with survivors, understanding their sense of their own vulnerabilities and needs is such a critical piece of that process. And so having those first responders equipped to truly to know how to engage, know those barriers and fears that might be present, and really approach survivors with that posture is so critical. And that's true whether in the UK or really around the globe.
Thank you. So unfortunately, that's all the time we have time for at the moment. Thank you again to our speakers for giving up their time to be here and for sharing your thoughts and experience with the audience. And thank you to our participants for the really stimulating discussion I've seen in the chat, which I'm sure there'll be an opportunity to continue later.